Asthma, as many clinicians know, is a disease of reversible airflow obstruction, bronchospasm, clinically categorized into 4 different categories, intermittent being the initial that's typically treated with just a albuterol rescue inhaler as needed, and then the next 3 are part of the persistent asthma group, divided into mild, moderate, and severe. So we really want to focus not only on looking at what the appropriate medications are for treating asthma, but actually patient compliance. Coming from Newark, New Jersey, patient compliance is always of utmost importance. A lot of our patients aren't compliant, and often we wonder why, and if that correlates to their asthma control. So we basically decided to look at adult patients with asthma, any category, and basically evaluate to see if they were carrying their inhaler, rescue inhaler with them to the visit. And we use that as a marker of compliance, meaning if they had it with them, we basically hypothesized that their asthma control test score would be higher. So we looked at, it was a small study, about 20 patients, and we found that 15 were carrying their inhaler with them, and 5 were actually not. And when we did the analysis, we actually found that there was no statistical difference between those that had their inhaler with them and those that did not, and their asthma control test score. I think it just kind of shows you that's a good starting point to kind of start looking at compliance within patients, because obviously if they're not taking their medications, they're not going to work optimally. So what's the point in adding more and more? I think we really need to get to the root of why they're not taking their medicines, or perhaps why they're maybe not carrying the rescue inhaler with them when it is called a rescue inhaler, so they technically should be carrying it with them all the time. So I really think it's just a good place to kind of start with and start thinking about compliance for clinicians and focus on that. Well, the other thing that we actually looked at in our study was if they were using it properly. Sometimes the patients aren't using their medicine properly, or they don't really know what to do with it, an inhaler device often. They may not carry it, or they may not be using it. So I think definitely reviewing inhaler technique with patients, going over, making sure they know how to use it, that could possibly start to improve their compliance. And really just sitting down with them and asking them why maybe they're not taking their medicines. Sometimes if it's even an inhaler or a pill or something like that, the amount of times that they have to take it per day, whether it's once a day, twice a day, as you increase the dosing, frequency, it may deter them from actually taking it. Yeah, and I feel like asthma now, as we all know, it is shifting more into not just an isolated disease, a single type of disease, but it's really a spectrum now, and we're really looking at all the studies that are showing different endotypes and phenotypes, and then using that to guide our therapy, because we have a lot of biologics coming out, injectable drugs, which is really exciting right now for us.